Thank you. I'm very glad to be here and represent Region 9 PASU at your conference and bring some of this information that I've learned since I've been working on this green cleaning, sanitizing, and disinfecting toolkit. I have a few copies of the toolkit, and we can pass them around or leave them somewhere for you to look at. Why is adopting a green cleaning, sanitizing, and disinfecting program so important? Many of the products that we use to clean, sanitize, and disinfect in schools, office buildings, wherever we use them in our homes, contain toxic chemicals. And as Jerry pointed out, children are a lot more sensitive than adults to the health effects of these toxic chemicals. So when we're talking about environments where children spend a lot of time, it's important to think about what chemicals we're putting into that environment. And again, as Jerry mentioned, the health effects from exposure to these environmental toxins may not show up for years or even decades. So when you're talking about young children, they have a lot longer time in which to develop illnesses related to these exposures than adults. And some people argue that up to a third of childhood cancer may be due to environmental causes. In child care in schools, many of the staff on site are women who are pregnant or are childbearing age. And so pregnant women and fetuses are particularly vulnerable to the health effects of these hazardous products used to clean, sanitize, and disinfect. And finally, as Jerry mentioned, we want to practice what's called the precautionary principle. And we don't want to wait until we have every absolute known research finding before we take action to protect children. We need to protect them when we suspect things and then wait for the manufacturers to prove that their product is in fact safe. So I hope by the end of this presentation you'll understand something about the hazards of group care for young kids. We all know it provides ideal conditions for the transmission of infectious disease. And then again, how to protect children from and staff from both from infectious diseases and from the harmful health effects of these products that we use to clean, sanitize, and disinfect. And I hope you'll be able to go home and choose and use the least harmful products to clean, sanitize, and disinfect in your homes and workplaces. And I also want to, I hope you'll go away from this understanding that our behaviors can actually be a very important way to reduce the risk of spread of infectious diseases, sometimes as well as or even better than chemical products. And I hope you'll start your own green cleaning, sanitizing, disinfecting program. So what are infectious diseases? We talk about them a lot, and sometimes people are not too clear about what actually an infectious disease is. They're spread by germs, also called microbes, from one person or an animal to another. They're very common in early care and education, schools, and of course medical offices. And I just want to point out that for those of you who work in child care, children and young children in child care have symptoms of disease or illness 1/3 to 1/2 of the days out of the year, and that this is normal. This is something that in our modern world we don't like to really think about this because it impacts parents who have to take time off of work when their kids are sick. But it's really a normal state of being for young kids. So there are different kinds of germs that we're dealing with in these environments: bacteria, viruses, fungi, parasites. And they get into our bodies in different ways. And I want to just stop here for a minute and talk about some of the very interesting work that's being done on the role of these microbes in our bodies. Louis Pasteur, who first proposed the germ theory of disease in the 1800s, insisted that a healthy human body was completely sterile. And these inaccurate ideas have come forward to the current time pretty much intact, and we've had this idea that getting sick and being exposed to microbes that are invading our body's sterile state is a really terrible thing. When in fact it turns out that microbes are essential to our health. We have 10 times more of these microbial cells in our body than we have human cells. That's a pretty impressive number, and most of them in our gut. Some scientists who are studying these microbes and their health effects refer to this as an additional organ in our body because the role that it plays is so important. So we're just beginning to understand all the things that microbes do in our bodies. They help us to digest our food. They help us to regulate our immune system so it knows the difference between friend and foe, thus preventing the development of allergies. And these microbes help to protect us from the 1% of microbes, which we call pathogens, that cause disease. And there's even some evidence that these microbes influence our moods and may have a role in the development of some neurodevelopment disorders. So they call this our microbiome. And our microbiome may have as much to do with our health as the genes that we inherit from our parents. And as I said, only about 1% of these microbes actually cause disease. And we have to think differently about the role of microbes in our world. The other thing that we're beginning to understand more clearly is that exposure to common childhood infectious diseases in early childhood is very important for the development of children's immune systems. So when we think of making environments as germ-free as possible, we may be doing children a disservice by not allowing them to come down with these infectious diseases that in fact prime their pump, to prime the immune system to function properly. So how are these infectious diseases spread? They're spread in body fluids, blood, mucus, saliva, vomit, etc. And a good rule is if it's wet and comes from someone else's body, it's likely infectious. So we get infectious diseases from direct contact. You know, a kid sticks his finger in another kid's nose or mouth and then sticks it in another kid's lunch, and then that kid gets sick. Direct contact, also touching, kissing, things like that. Droplets are another way that infections are spread. So when kids sneeze, cough, spit, drool, slobber into the air and then land on another person or a hard surface, and then someone touches that hard surface, and then their eyes or their mouth or their nose. This is how the flu is spread. And then there's airborne transmission. Germs that float suspended in the air attached to moisture, droplets, or dust particles. And they can travel more than 3 feet, quite a lot more than 3 feet. And these are actually the infections that are spread this way are very hard to control. And when vaccinations are available for things like chickenpox, that's about the only way you really can prevent them, because they're so able to spread through the air. You've heard of stories of kids being hospitalized with the chickenpox, and somebody 2 floors up and 2 buildings over comes down with the chickenpox. It's very contagious. There's fecal-oral transmission. Germs in the stool of one infected person make their way into the mouth of another person. Blood is another way, and people are very anxious about blood in schools and childcare, and in fact, the transmission of infections through blood is very, very uncommon in these settings. Insects is another thing that we're becoming more concerned about because they're a vector for diseases that are becoming more common, and you have to watch your environment. I'm assuming that Lynn will talk about this when she talks about IPM. It's an IPM issue. So how can we reduce the spread of infectious disease? These are the things that we know, that development of written formal policies for reducing the spread of infectious disease help. And these include policies about vaccination, formal education of child care center and school staff concerning infection control, good hand hygiene by both staff and children. We know that in child care, caregivers' hands are among the most contaminated surfaces in the whole environment. They're changing diapers, they're wiping nose, they're holding hands, and so hand washing is important both for children and for providers and teachers. And then appropriate cleaning and targeted disinfection when it's necessary and where it's necessary of contaminated surfaces. And then in childcare, this isn't such an issue in other places, but separation of food prep and diaper changing facilities is very important. So by cleaning, we tend to focus on reducing the spread of infectious disease by cleaning, sanitizing, and disinfecting. These things are different. Cleaning actually washes germs down the drain. It doesn't kill germs. Sanitizing and disinfecting with chemicals or devices kills germs. And then vaccinations. Vaccinations, I come from a part of the world where the most wealthy county in the Bay Area is the highest reservoir of unvaccinated kids in the country. It's a very frustrating experience. And we've had outbreaks of whooping cough and measles because people aren't vaccinating their kids. And it's an interesting thing. People are worried about their kids' immune systems being overwhelmed by all these vaccines. And in fact, some of this new research suggests that when you give a kid a vaccine, you're actually contributing to the priming of the immune system. It's more stuff for the immune system to respond to. So it has a positive role in that sense. So, and as I mentioned, personal behaviors. I do a lot of my work in childcare, as you heard. So it's very interesting to watch how well very young children learn these habits of sneezing in their sleeve and washing their hands and brushing their teeth. And it's sort of the role that I think I've come to believe is the most important in terms of health and early care and education, is to teach children these habits, because if they don't get taught in that early period, they don't learn them. And they're very effective ways of preventing the spread of infectious disease. When you sneeze in your sleeve, the germs get caught in the textiles, and they don't live very long in those environments, as opposed to spraying it on a hard surface like a doorknob or a table. So I'm going to talk now about why it's important to clean. And as I've done this work, I've come to believe more firmly or more completely that one of the main reasons for cleaning, when we walk into buildings, we carry into the buildings all kinds of chemicals on our shoes. It's a good argument for taking your shoes off at home and for having walk-off mats. But there have been studies on surface sampling studies in childcare where they found residues of pesticides that were banned in the 80s. They take a very long time to break down in indoor environments. So actually, cleaning is a way to reduce the exposure of children to a lot of these toxic chemicals that we use indoors. I'm not going to go through all this because Jerry's talked about this. But for young kids, it's really important that they put a lot of things in their mouth, and it's dust, it turns out, absorbs to hands and to objects, and then kids put it in their mouth, and they're ingesting a fair amount of dust, and dust is a reservoir of a lot of toxic chemicals. So when you clean and get rid of these things, you're getting rid of things that are going to affect kids' health. I mean, it's also a way to reduce the amount of germs that kids are ingesting as well. This graphic just explains what Jerry talked about. Kids are exposed proportionally greater to toxic chemicals than adults. So there are other reasons we use to argue that people should keep their schools clean. Children feel better. The research shows that when schools are well maintained and clean, that kids and staff feel better about being in them. They learn more as a result. And Getting rid of a lot of clutter helps make it easier to focus on tasks, and it also makes it easier to keep the environments clean, keeping pesticides, hiding places for pests gone. You go into a lot of schools and child care centers, you open the closets and it's stacked to the ceiling with stuff, and in the back are the little rodent nests. So, also, Jerry talked about mold. The presence of moisture or standing water in our buildings is a major cause of mold and can cause respiratory problems like allergies and asthma. So cleaning also removes germs that can cause infectious disease. Cleaning removes the oil and the grease that can prevent sanitizers and disinfectants from coming in contact with germs. It removes biofilms that hide bacteria. Biofilm is what bacteria create when they grow and thrive in a wet environment that also provides food. And they form this sort of protective community that's extremely hard to get rid of. And a lot of disinfectants don't penetrate into biofilm, and it's everywhere. To me, it's a big important issue that we haven't really dealt with when we talk about disinfectants, because so many bacteria actually live in the form of biofilm. So preventing biofilm is done by keeping things dry and clean. Cleaning also protects the materials in our environment. So kids in childcare get sick more often than kids are cared for at home, and they get sicker. So we do have to address the issue of infectious disease because colds, flu, and asthma are the most common reason children are absent from childcare and from schools. The other issue is that we found that schools and childcare centers are a major source of the spread of epidemic illnesses. So it's actually been proposed by the CDC that in the event of a major flu epidemic, that this childcare centers and schools be closed, because we'll reduce the spread by just doing that dramatically. So the products that we use to do this cleaning, sanitizing, and disinfectant have problems. A lot of people think that the products that are on the market, that someone has looked at the ingredients and that the government has decided that they're safe, that they're not going to cause health problems, which is in fact not true. Most of these products are not safe. The only thing that has to be on a label is that the active ingredient in a disinfectant has to be listed. And otherwise, manufacturers are not required to list the ingredients on the label of any cleaning, sanitizing, or disinfecting product. And that makes it very difficult for both institutional purchasers as well as ordinary homeowners to make choices about using safe products. The other problem is that many people think that when a product has the name, the marketing word green or natural or organic on the label, that it's safer. For instance, people started using Simple Green because of the word green, and in fact, Simple Green is a very unhealthy product. So, and these labels are not regulated by the government. And when they look at some of these products that have these terms on the label, they find that they have as many toxic chemicals as conventional cleaning products. So all these gaps in ingredient information on the product labels makes it very difficult to know what to do. One of the main concerns we have about these products is their role in causing or exacerbating asthma. Asthma is very common in kids and adults, and we don't want to be contributing to the increase in the prevalence of asthma by the products that we're using to clean, sanitize, and disinfect. And of course, once someone has asthma, then they're subject to being triggered by all kinds of other things besides the cleaning, sanitizing, and disinfecting products. The other issue that we found is common in these chemicals in these products is that they contain endocrine disrupting chemicals. There's been a lot of press recently about these chemicals. The EPA used to look at chemicals and say, you know, this is the threshold. Beyond this, if someone's exposed at a higher than this amount, they will suffer consequences. But below this, the product is safe. And they're actually finding that some of these chemicals, if you're exposed at this level, you don't have long-term health effects. But if you're exposed to these chemicals extremely low doses, that they act like hormones in our bodies. And it's a very troubling sort of development, this hormonal-like role that some of these chemicals can play in our bodies. And they're finding that these endocrine disruptors can cause reduced fertility in women and men, early puberty in girls, and cancer of the breast, ovaries, and prostate. The other thing is the environment. We can have a clean building, but we may be causing damage to the environment by the products that we use to clean the building. I'm going to use Triclosan as an example. Triclosan is a really common thing used in antibacterial soaps and many cleaning products. And they slow the growth of bacteria, fungi, and mildew. And they get washed down the drain, and they go into the water treatment plant where they are not removed, and they end up in the sewage treatment plants. They divide what comes out into sludge and then effluent that they discharge. And the Triclosan is concentrated in the sludge, and they often spread it on agricultural fields. And they've actually found Triclosan absorbed by carrots and zucchini in studies. So there's a whole cycle of this stuff that comes back to us in our food when we wash it down the drain. So again, we have to be very careful about what we're using and what role it plays in our environment. Triclosan collects in human tissue, and they find it in umbilical cord blood of infants and in breast milk. It can interfere with thyroid function, causes skin irritation, and in a couple of recent interesting studies on zebrafish, it affected the contraction of both skeletal and heart muscle. So there's still a lot that we don't know, but in my mind, this is an example of the precautionary principle. We know enough about it that we really should not be using it. Fragrances are another thing that the manufacturers have a very hard time selling products without fragrances. People think that when you smell it, it's clean. People associate. I go into a bathroom that's been cleaned with Comet, and I have this visceral reaction. That's what I grew up with. Oh, it's clean. And it's a big bias that we have to really get past, because these fragrances are particularly concentrated group of these chemicals that have many health effects. They're found in most of these products, and so these chemicals are volatile organic compounds, and they affect both indoor air and outdoor air quality, as well as the water supply. And again, they're not filtered out by the water treatment plants, and nearly all of the fish and the shellfish in the United States are now contaminated with these VOCs. These fragrance products contain additional chemicals that can cause health problems. They can cause lung irritation, skin irritation, and eye irritation. And again, just because a cleaning product smells good doesn't mean that it's done its job. We have been promoting the phrase, clean isn't a smell. The other problem is that even and this goes back to the problem of lack of adequate labeling of all these products, that even when a product is fragrance-free, it may actually have a chemical in it that masks the smell. So there is fragrance in it that masks the smell of the chemical, and I mean, it's still better to buy an unscented product, but you can't be assured that what you're buying is really something that doesn't contain a fragrance. So we recommend that people buy things that don't contain fragrances. And the only real way you can understand what's in a product is by buying something that's been certified by a third-party organization. This is a very important point. It's your take-home point for today. Because of the lack of adequate labeling, the only way to be assured that you're buying a safer product is to buy something that's been vetted by a third-party, independent third-party agency. And there are three of them. There's Green Seal. That's probably the largest. Ecologo is a Canadian company that was recently bought by Underwriters Labs, and we're sort of looking at what's going to happen with Ecologo. And Design for the Environment is part of the EPA. So Green Seal tends to certify products that are only available through distributors. So for those of you who work in school districts or big buildings and you buy your products through a distributor, you can require that your distributor provides only products that are certified by Green Seal. For people who are buying retail products, Design for the Environment does more with the retail products. So I recommend that you also avoid scented candles, air fresheners. These are things that we find in schools and child care centers because they have problems with their ventilation system. So rather than fix the ventilation system, because there's no money, they use candles and air fresheners to clean up the smell in the room. I had one provider who said, I changed 90 diapers today. I was spraying Lysol in the air just for odor control. It's a problem. So if you do use these products, open the windows and try and get the smells out of the room. So when you clean, sanitize, and disinfect, you have to decide what process you need to do for what surface. A lot of surfaces you just need to clean. In childcare, we have standards. These are the standards from the American Academy of Pediatrics Caring for Our Children book. They're more stringent than the school standards, so that they're cleaning, sanitizing, and disinfecting more often than they are in schools. But cleaning uses a detergent and water to physically remove dirt, grime, and germs from surfaces. It doesn't kill germs, it removes them. And it removes mold and allergens that can trigger asthma. And the interesting thing is there are new cleaning products out there made out of microfiber, and the microfiber actually in studies is found to remove as much as 99% of the germs when just used with an all-purpose cleaner. So if you've got an outbreak in your building of an infectious disease, a really effective strategy is to just have a lot of microfiber cloths around, and you just rub them with your rub doorknobs and high-touch surfaces with microfiber and all-purpose cleaner. Third-party certified. So disinfecting inactivates germs, 99.999% of germs on surfaces, if it's allowed to dwell. This is a really, really important point. How many of you use bleach to disinfect? Anybody? Do you let it sit for 5 minutes before you wash it off? Yeah. I do this talk in childcare. And they use bleach all the time, and almost nobody raises their hand at that point. So what happens when you take antibiotic? Your doctor says, take this antibiotic for 10 days, and you take it for 2 days. What happens? Yeah, you kill off the weak germs, and you leave the more virulent germs. And people are doing this all the time when they don't leave these products to dwell for the required time. And sometimes when you read the label, you know, like for a lot of quaternary ammonium compounds, the dwell time is 10 minutes. That means glistening wet for 10 minutes. You may have to reapply products to keep them glistening wet for that long. So if you don't leave them for the dwell time, you're not accomplishing what you think you're accomplishing. So you might as well not use a more expensive and a more toxic product and just use a cleaning product. Yes. Well, it depends on your situation. In childcare and schools, we recommend a 1:64 dilution. I'm going to talk about bleach, but bleach is a big problem in schools and childcare centers because it causes and it exacerbates asthma. So we're really encouraging people to switch to safer products for disinfecting from bleach when they're using them all day long, because staff has to be mixed up every day. I'm going to get to this, but it's a problem. So sanitizing is the reduction. People are sort of confused about what's the difference between sanitizing and disinfecting. They see those 99.99 numbers. And sanitizing is a reduction by that much. Disinfection is an absolute kill of that much. So sanitizing is often done on food contact surfaces, and you have to use a sanitizing product that's made for the surface that you're applying it to. So it will say on the label whether it's a food contact surface sanitizer. And you should make sure that you're using the product that is appropriate for the surface. So a lot of people just want to use a disinfectant everywhere. You know, we have these outbreaks of viral illnesses like H1N1 and MRSA, and the marketing people really work us up into a frenzy about these infectious diseases, and people get frightened and they just want to disinfect all the surfaces. So there are reasons why you shouldn't do that. If you don't clean before you disinfect, many disinfectants won't work. The microorganisms can hide under dirt and they won't get disinfected. The oils and on the surface can interfere with the operation of the disinfectant. So you do need to clean. Unless the product is specifically labeled as a two-step product that will both clean and disinfect, you always need to clean before you disinfect on a surface. The products used to disinfect are always more toxic and usually more expensive than products used to clean. So that's another reason not to do it all the time. And again, overusing all these antimicrobial products may be leading to the spread of superbugs, the development of superbugs. Some of these disinfectants, particularly quaternary ammonium disinfectants, are associated with the development of germs that are resistant to both the disinfectant and to antibiotics. So we don't want to overuse these things. So you really have to be clear about what surfaces in your environment need to be disinfected and what surfaces can just be cleaned. So these are the logos for the third-party certifying agencies. You'll see these. Unfortunately, they're very small on the back of the product. So when you're in the grocery store, you can look for this Design for the Environment label. And that said, right now they're in the middle of redesigning this label. But it will still say Design for the Environment, and it's a good thing to look for that on the back of a product that you're buying in the grocery store. So institutional cleaning products, if you're in a position to purchase from a distributor, you're better off because you get access to more products that have been reviewed by Green Seal. These products often come in a concentrate form, so they're both less expensive, and they're also better for the environment because you aren't paying for the shipping of a lot of water. I recently bought a Green Seal certified all-purpose cleaner from Staples. It was something like $35 for a gallon, and it made 157 gallons of cleaner. It came out to 15 cents a gallon. So I encourage people to buy these concentrated all-purpose cleaners that are cheaper, and then it offsets the cost of the more expensive disinfectants. The other thing is that many places who are using all these cleaning and sanitizing products don't have a hazard communication program in place. This is an OSHA required program that protects workers from exposure to chemicals that might cause them health problems. And part of that program includes the use of safety data sheets. And all the institutional products will come with the safety data sheets. And when you buy a retail product, you've got to hunt around and find those safety data sheets so that you have them on site. And as I said, they're less these institutional products are less expensive. We've been trying to encourage childcare programs to sort of band together to form a buying club. So if you're in a situation where you don't consume enough to go through a distributor, try and get together with some other like kind of program so that you can get access to these products. So when you're choosing to choose safer cleaning products, another thing that you need to look at is beyond the third-party certification. If you're in a place where you can't find one of those, look at the signal word. You always want a product that has a warning instead of a danger. Go home and look under your sink and look at all the products under your sink. I'm afraid you'll find a lot of products with a signal word of danger on them. You always want things that are not aerosolized. So the aerosol products put things into the air where it's much easier to breathe them in. You want things that are fragrance-free and dye-free if possible. And if you can find products that have all the ingredients listed on the label, it's usually true that they're safer products if they're willing to put them on the label. And you want to buy something that doesn't have an overwhelming chemical odor. These are some of the chemicals. They're hard to remember. You have all the slides on your flash drive. This is why it makes it so difficult. Even if they did put them on the label, being able to decipher all these chemicals is a hard thing to do. So that's why we really recommend that people go to the third-party certified products, because Green Seal does all this work for you and determines which of these chemicals are present or not present. The other thing about a lot of these products is people will put them on and then not rinse them off. And when it dries, those chemicals that are in the product will flake off and become airborne. So they affect your air quality in that way as well as when you're using them. A lot of people use products to disinfect, like they'll use a bleach they pull off the shelf that doesn't have an EPA registration label, and not all bleaches are disinfectants. So you have to make sure that whatever product you're using has an EPA registration number, and they're actually very small, and they're on the back of the label. For sanitizers, again, you want to make sure if you're using a sanitizer on a food contact surface that it's meant for a food contact surface. There's a system of rating, the hazardous material identification system. Has a rating scale, and that you can find that on the safety data sheet, and you want one with a 0 rating. I mean, this is all the sort of detective work you have to do if you're not going to go through buy a third-party certified product. Again, you want to look for a signal word of warning rather than caution or signal words caution or warning, not danger. And again, you want to look for, when you're choosing these products, you want to look for a product that has a short dwell time, because in reality, you're not going to let a 10-minute dwell time product sit there wet for 10 minutes. So you want something that's going to do it in a shorter amount of time. The disinfectant is pretty much the same as the sanitizer. Okay, so bleach. Bleach is cheap. It's everywhere. Everybody knows it, and everybody thinks of it in a friendly way. But bleach is not so friendly. As I said, bleach we now know is asthmagen. So when we were doing our toolkit, at that point, we just decided that we weren't going to say it was okay to use bleach because it's cheap, because it causes health problems. Asthma is one of the most common health problems we see in young kids. And it became an ethical issue for me. So in addition to causing asthma, it can irritate the skin and eyes, and it was the source of 35,000 poisonings in 2011. I don't know if any of you saw, but this week there was an incident, I think in New Jersey, where someone mixed up bleach, put it in a milk container, and a food service person poured the water from the bleach jug into the kids' glasses, and 20-something kids went to the emergency room. People also mix up bleach and apply it with ammonia, and it produces a toxic gas. The Department of Pesticide Regulation in California, disinfectants are actually registered pesticides. So DPR keeps a database of pesticide-related injuries. And when you go and look at these injuries for the last 10 years, something like half of them are bleach. So it's not a benign product. And kids who are breathing it in, and in child care, I know it's not as much in schools, but in child care where they're changing diapers particularly, they're using it all day long. The other problem is that it's got a short half-life. It has to be mixed up every day, and it has a short shelf life. You can only buy, it expires in about 3 months' time, so you have to replace it after that amount of time, and you have to mix it up every day. Does anybody here have to mix up bleach for their job? In childcare, when I asked that question, many of the people raised their hands. So many people are mixing bleach up in the workplace. They have no personal protective equipment, no masks, and they're pouring this concentrated product into a spray bottle and adding water to it. They're leaning over all of this as they do it, and it's very interesting to watch their faces when I talk about all this, because they're realizing that maybe this is why they've got asthma. Yeah. So you mix bleach with this is another very common cause of poisoning, is to mix bleach with other products that causes these toxic gases. The other thing that a lot of people don't realize is that bleach corrodes a lot of metals. It shouldn't be used on stainless steel, aluminum, copper, brass, marble, granite. And again, it's neutralized by organic material, so if you don't clean before you use it, it's not going to do its job. The other thing is that they've just increased the concentration of bleach. So now when you mix up bleach in a spray bottle, you're even more exposed to a more highly concentrated product. And people are confused about how to mix up the proper dilution. So, someone mentioned a 10-to-1 dilution, and you would only do that for a blood spill in schools or childcare. For routine disinfecting, you don't need that concentrated formula. And again, there are a lot of bleach products on the market that don't have an EPA registration number. They're not effective disinfectant. So you may have to make sure you buy a bleach that has, if you're going to use it. Devices. These have become my new favorite thing. And this device, you see a picture of here, there are a number of them on the market. They're steam cleaners. And the Toxics Use Reduction Institute at UMass Lowell, which assesses all this stuff, tested one of these machines, and they said it killed everything instantly, including things in biofilm. And they all were fighting over who got to take it home for the weekend because it cleans grout. It cleans and disinfects all at the same time. And I actually rented one because I was recommending things for childcare. I wanted to see how safe it was, and it's extremely safe. And it has all the attachments like a vacuum cleaner. The main problem with it is that it's a very expensive unit. These units cost, $1,000, $1,200. But I think that this may be where things are going. Now, for our colleagues in the EPA, we have a big problem in childcare, at least, because the EPA does not register devices to be disinfectants. They register devices, but they don't certify them the way they do chemical disinfectants. So for regulatory bodies, it sort of leaves these devices in a no man's land because they don't technically, they don't have the label of being a disinfectant, even though that's what they do, and they do it very effectively. The other thing about these devices is that you can use them on textiles. So, a kid throws up on the rug. You put a disinfectant on a rug and it doesn't work. It's only meant for a hard surface. So you can use this on a rug or a sofa, and you'll clean it and disinfect it, which is a big advantage of these things over chemicals. There's another system that's been developed. It's called Orbio. This it basically uses water, and Temple University has a whole system using this Orbio system that they say they've gotten rid of all their chemicals, and all they use is this Orbio system that takes tap water and Orbio. Yeah, it apparently what it does is it causes electroporation of microbes. It sort of basically causes the microbes to burst. And it does it with water. And TURID, the Toxics Use Reduction Institute, says that that it's a great product as well. So I think that these devices are actually the hope of the future, that we can get away from chemicals altogether by using these things that use water. Well, I mean, a lot of IPM people are using heat to kill bed bugs, so I would imagine that this would be a very effective way to deal with them. Yeah. Is Lynn here?
Which I won't talk much about in my talk because otherwise that'll be all we talk about, is that it's actually hitting them. So when someone says it works on bed bugs, I say define works. Because if you hit them, it may work, but in everyday use, many things that are used for bed bugs doesn't actually hit the organism because they're little itsy bitsy teeny weeny things crammed into crevices. So foggers, for example, don't really work on bed bugs because it doesn't hit them. So steam and heat and all these things that blow up their bodies is great, but you have to hit them and hit them long enough that it blows them up or whatever.
Yeah. Okay. All right, microfiber. This is my other new favorite thing. Microfiber is a fantastic invention. They're extremely fine split hairs in microfiber, and when you buy them, this actually creeps a lot of people out. But if you run your hand a long microfiber, it'll sort of catch. The best quality microfiber is the stuff that catches the most. So if you get no catch when you're looking at it, don't buy it. Look for stuff that catches. It removes organic matter as well as germs, and hospitals have found that in a study they looked at microfiber mops in an all-purpose cleaner versus a cotton mop and a disinfectant, and the microfiber mop exceeded the effectiveness of the cotton mop with the disinfectant. The other thing is that the microfiber mops are much lighter to use. You can pull, they Velcro, the mop head Velcros on. It's just a piece of fabric. It's about like this, and it's very light. You can pull it off, throw it in a bucket, put a new one on, so you're not transferring germs from one room to another. You can wash them 1,000 times. If you're not using paper towels, you reduce landfill waste. And they work great with the alternative cleaning products, the safer cleaning products. The only thing is that you have to have a laundering program for them, because if you launder them with cotton, the cotton gets into the microfiber and gums it up. So you have to wash and dry them separately, and you don't ever want to use bleach or fabric softener, because that will gum them up as well. But they really, when you look at microscopically, cotton actually pushes germs around on the surface, and microfiber has an electric charge that absorbs them into it. So it attracts it and holds it. Sponges are the perfect source of a growing medium for, you might as well use a sponge as a Petri dish. They're warm, they're wet, and they've got food matter in them. So they're a perfect thing for growing bacteria. If you want to use a sponge at home, put it in the microwave or put it in the dishwasher when you run the dishwasher. So I've got some lists of safer products. A lot of these safer disinfectants are accelerated hydrogen peroxide products. There are also citric acid and lactic acid based products. The EPA's Design for the Environment program has a new disinfectant pilot project going on. One of the problems with disinfectants is that the third-party agencies are legally not allowed to certify disinfectants as safer. So the only place you can go for a safer disinfectant is the pilot program. That said, the San Francisco the City of San Francisco Toxics Reduction Program has taken a close look at all these products, and they actually have a list of disinfectants that they recommend. So between the EPA's pilot program and the San Francisco's list, there are a number of disinfectants there. Most of them are hydrogen peroxide based, but they're a good start for changing into a green cleaning, sanitizing, and disinfecting program. These are all in you have a copy of these slides. So the good thing about the San Francisco products too is that they're all concentrates, so that you're not paying for a lot of water, and you're not spending the carbon to transport a lot of water by shipping. So this is about the toolkit. This is a toolkit. This is what we developed for use in childcare to address all these issues. And it contains a curriculum booklet that has all this information that I talked about today. And there are 4 actually now. There are 3 posters now, because one of them, which both the UCSF lawyers and the DPR lawyers said was completely legal, the provider said, just tell me what to use and what not to use. So we made this great graphic. It said use, don't use, and the don't use had bleach on it, and the lobbyists came down on DPR so hard they made us pull it. So now there are only 3 posters. There are a bunch of fact sheets that can be standalone, and a couple of fact sheets for families. So it's all in this toolkit, and it's all available online for free. If you Google CERCH and Green Cleaning Toolkit, you'll find it. And you'll also find that's on the Center for Environmental Research in Children's Health. My colleague Asa Bradman and I also worked on the IPM toolkit, and both those toolkits are available on the Search website. There's also a little wallet card. I brought some of those today. And a checklist to help you start a green cleaning, sanitizing, and disinfecting program. So I think a lot of these materials are good for schools as well. And as Veronica mentioned, I'm about to start another project to work on how you can use cleaning strategies to reduce kids' exposure to PCBs, because this is an emerging issue that a lot of school buildings were built with caulk and actually continue to be painted with materials that give off PCBs. So PCBs have a lot of health risks, and so that will be the next stage of this toolkit. We'll be adding materials to it on how you can deal with PCBs. That's it. Any questions? Yeah.
I'm not sure if you know the answer to this question, but is there any work being done with hospital systems in terms of use of bleach, especially in populations that are immunocompromised, like oncology, pediatric oncology, neonates?
You know, Kathy Gerwick, who works at Kaiser Permanente, just published this book, and it's a whole account of what's going on in hospitals. And there's a tremendous amount going on in hospitals, and I encourage you to pick up this book. There's Healthcare Without Harm and two other, what? Practice Green Health. Yeah, Practice Green Health. And so those would be great resources for hospital-specific recommendations of what to be used. But a lot of hospitals are switching to these hydrogen peroxide products. Yeah, so this is a great story, actually, of one person who made a huge change, and Kaiser also affected the whole healthcare landscape by their changed practices.
A quick question: how do you? Over here. Sorry.
Oh, sorry.
I'm a school nurse, and I also work with Children's National Medical Center, and we utilize the Sandy wipes, or the wipes with the purple lids on them, or the green lids, or you can go to Washington Hospital Center and see the yellow lids. Are those products safe to use too on counter surfaces? I know they have a dwelling time of like 2 to 3 minutes, and you're supposed to utilize them with gloves, but
the problem with those, I mean, there's some hydrogen peroxide wipes that we do recommend if there's no other option. But the problem with them is, do they really put enough on the surface to leave it wet for 2 or 3 minutes? I mean, in my experience, it dries before it's sat there for that long. So that's the problem with those.
A quick follow-up on that is, and that was a great question, because I feel like wipes are actually an extremely misleading product in terms of their effectiveness, but yet they are so pervasive and seen as a convenience product, where if they were actually used correctly, they would be much more inconvenient because you have to sit there and wipe it.
Right.
So I think that's an important point. But I wanted to ask you about fragrances with respect to the third-party certifications. And I think I've seen Green Seal products that definitely are fragranced. And the question I have is, are they safe fragrances, or are they no fragrances? And let me add to that is, I think Design for Environment has come under fire for loosening some of the requirements.
Well,
could you speak to that?
Yes, they do. What they've told us is that manufacturers say that people won't buy these products if they don't have any scent to them. So that they've developed a list of safer fragrances that they allow in their DFE certified products. It's not perfect, And the Green Seal products are probably more stringent, but for people who are buying retail products, it's sort of the best that we can. But they have come under fire, and it is an issue.
There's a lady there with the red hair.
There we go. What's the safest way to dispose of cleaning products that we might be replacing with safer ones?
Every county should have a hazardous waste disposal place, and I've taken mine to those hazardous waste disposal.
Do you need hot water to wash your hands?
No, but for kids, I mean, I think it's more comfortable to use hot water, but you don't need hot water. No.
Hi.
Hi.
My question is about, given what you're saying in terms of exposures and conditions, how can we turn some of the information and knowledge into action so we can move this ahead, so we don't have these kinds of continuing problems? Do you have any suggestions for that?
Well, I mean, my direct experience is in childcare, and for instance, there are many states that actually require the use of bleach in their regulations. So changing our regulations to acknowledge that there are safer products, preferable safer products, is one thing. And I think, encouraging organizations to adopt green cleaning policies. So you actually outline, what does it mean to have a green cleaning policy? What do we need to disinfect, and what should just be cleaned, and what are the products that we're going to use? I mean, many organizations, schools who have switched to this green cleaning, they have an initial increased expense of the microfiber products and maybe some of these devices, but then down the line it costs less. So it's a good incentive to get people to make these changes. Beyond the health changes, most people are motivated by dollars and cents, but there is data out there that shows that it's cheaper to use these things. And just everywhere that anybody's working, my daughter works at the NYU Child Studies Center, and they have these plug-in air fresheners in the bathrooms, and they're dealing with kids with neurodevelopmental disorders. And she says, "Mom, what do I do about this?" I told them, they took them out, and now they're back again. It's an ongoing struggle. This idea of, smells is huge, and we really, as a culture, have to get beyond it.
Two quick questions. Regarding the fragrance, I was meeting with a janitorial supply company, and they indicated that their information was that the MSDS sheets would be changing,
Yeah.
and that fragrance in particular would have to start disclosing information on MSDS of what the ingredients are that make up that term. Do you know anything?
Yeah, I don't know that they've. That's what everyone would like, but I don't think that they're going to have to do that. I don't think we're there yet.
All right, that might be misinformation then, so I'll go back and tell them that. Thanks. And then regarding Triclosan, Minnesota, I believe, had banned Triclosan from personal care products in that state. Are you seeing that dialogue and discussion going on at that state policy level as well?
Well, I think there's been enough controversy that some companies are actually pulling it, but it's everywhere. Everywhere you see some, like fabrics that they say microban. That's Triclosan. It's impregnated into things. So as they deteriorate, they put it into the environment. So it's a problem. Yeah, more policy.
This will be the last question, please.
I was going to ask about sodium lauryl sulfate, because I have the MSDS sheet for what our school system uses, and it's Green Seal certified, and it's soap, and it's clear foam wash with no dyes and no fragrances, but it does have SLS and some other things that look kind of icky to me, but it gets the 0 rating. So what are your thoughts about sodium lauryl sulfate?
Well, I can't speak to that one in particular. I think that the Green Seal has the best standards, but all of this is a compromise. So I trust that if they've, if it's included in a product that they've given a 0 rating to, that it's probably okay, but it may not be perfect, So.
Okay, well, thank you very much.